It's Valley Focus, and I'm Kayla Mortellaro, your guide for the program as we turn our attention to two guests today. Melanie Mitros, Director of Strategic Community Partnerships with Vitalyst Health Foundation, along with Adrienne Udarbe, Executive Director of Pinnacle Prevention. How are you both today?
Doing great.
Thank you so much for taking some time here. So let's first and foremost talk about Vitalyst Health Foundation. What all does Vitalyst Health Foundation do and assist the community with?
Well, thanks for having us on and getting to share a little bit about Vitalyst Health Foundation and some of the work that we're doing. So we are a traditional grant maker, and we are also a partner in many different activities throughout the state of Arizona. So Vitalyst has 5 kind of major areas that we do work in. We work around access to care and coverage, healthy communities, civic engagement, capacity building, and transformative grant making. And it's really exciting to be online today, getting to talk with Adrienne and hearing more about some of our transformative grant making with our systems change grant.
Yeah, so let's dive into that grant process here. So Vitalyst has made it a mission to partner with the Arizona community in awarding grants to different foundations. And specifically this year, part of the Systems Change grants, it totaled $524,948. So how did this Systems Change grants program get started?
That's a great question. We actually started off with what we called innovation grants about 6 years ago. And these grants were looking at how are nonprofits throughout Arizona tackling different community issues in ways that are different than how we've all done it before. So last year, we heard from lots of community partners and other nonprofits that innovation was a tough word to kind of wrap their heads around. And what we were really trying to accomplish was changing the way our systems were working. So it was a great way for us to change the title of our grant program to Systems Change. So we're really hoping with these grants that they're able to make a long-term impact and improve the health of Arizona communities.
So specifically here with the Systems Change Grants program, what criteria are you looking for when people make their submission process?
So with a Systems Change grant, first and foremost, it has to be partnership. We know that being able to change the way a system works takes many partners. The second piece is that it has to be tackling changing a system. And 2 of the ways we look at changing systems are through policies and through practices. Some of our Systems Change grants are tackling state level policy change. Some are regional or local level policy change. And then others are practice changes. And that's a great example of with the Pinnacle Prevention grant is really looking at how do we engage community members to be able to make changes to the way we're doing business. So the way communities engage and finding out what needs they have and what they want to see for a healthy community. And then the third piece of that is, okay, what do we need to do differently to make this happen? And sometimes that's policy recommendations, sometimes it's funding recommendations, but really working collectively. And the one other piece I'll say that's an absolute requirement with these Systems Change grants is what we call an equity lens to the work. And what that means is that the community where the work is happening needs to be directly involved in coming up with the idea, helping create the grant, and then definitely in the implementation of whatever project you're working on.
Chatting here with Melanie Mitros, Director of Strategic Community Partnerships with Vitalyst Health Foundation, and Adrienne Udarbe, Executive Director of Pinnacle Prevention, and kind of learning a little bit more here about Vitalyst Health Foundation. And so now let's transfer over to Pinnacle Prevention, and that Pinnacle Prevention is one of the organizations that has received money from Vitalyst to the tune of $174,949 this year. So let's first and foremost talk a little bit about what Pinnacle Prevention is, how long this nonprofit has been around in the Arizona community.
Hi. So Pinnacle Prevention is located in Chandler, Arizona, but we serve Arizona statewide, and we've been around since 2014. And our work is really centered around growing healthy families and communities. So the way that we do that is we focus on making systems changes within our food system and system changes within our active living system and our built environment system, which is essentially the communities that we reside in and how they allow us to move and get to where we need to be able to go, to ride our bike, to walk, all of those different factors and all of those different elements.
And so kind of going based upon what Melanie was talking about here for Vitalyst and what the Systems Change Grant is looking for, partnership and then tackling changes to systems, how is Pinnacle Prevention then going to use this money that they've received to be able to do just that?
So our focus is on a 3-year systems change project, and it's tackling issues within our rural built environment system. So what we have seen is in urban communities, we may typically have access to things like public transportation and sidewalks and bike lanes and lots of different elements that allow us to move freely and easily. In rural communities, it's much different, whether it's from lack of infrastructure or lack of funding to be able to make these things happen, or just lack of population engagement. So what we will be doing over these 3 years is working to build a statewide community of practice that's going to dive deep into the decision-making and the policies that influence rural community members' ability to move and be active and to make change, but then really focus on 3 targeted pilot tests of change, as we call them. With the first year, we're going to be starting in Globe, Arizona, to really tackle some of the issues that they would like to see up there as community members.
Chatting here with Melanie Mitros, Director of Strategic Community Partnerships with Vitalyst Health Foundation, as well as Adrienne Udarbe, Executive Director of Pinnacle Prevention. And when you're talking about a partnership here, does this become then where the two companies work together simultaneously to achieve these goals, or how does that partnership kind of unfold over the next 3 years?
So definitely it's a partnership with the support of Vitalyst Health Foundation, but really this project is rolled out through the collaboration of other community partners in direct co-design with the community. So our other collaborating partners on this project include Living Streets Alliance, the Arizona Alliance for Livable Communities, Health by Design, and the Arizona Partnership for Healthy Communities. And together, what we're able to do through this collaboration is leverage our strength and our expertise to better address and tackle some of the issues that we see. But ultimately, the individuals that are guiding the work are the community members themselves. They will be the ones to inform the process, design the process, and carry the process forward.
So specifically here, going back to Pinnacle Prevention and how you guys are starting things off with Globe, was this a decision that Pinnacle Prevention and the management team kind of looked and solidified and said, hey, let's go in and tackle Globe? Or did Globe's governmental entities kind of reach out and say, hey, we could really use some help, and we think that our what we want to try to accomplish aligns with what Pinnacle Prevention is all about?
So Pinnacle Prevention has a long history of working within the community of Globe on several different health initiatives. And so when we were looking at which communities we wanted to start with, there were several factors that influenced that selection. One was our existing relationships that we had within those communities, definitely the political will and the leadership support to carry out the work as well as community champions within those communities that were ready and willing to partner to move the work forward.
If people who are listening to this program here have just kind of an interest in what Pinnacle Prevention is all about and kind of just checking in and seeing how the progress is going with Globe and other initiatives that you have as part of this 3-year-long process, how could they go about finding out some more information?
Sure. So all of the information about our project and our progress on all of this work can be found on our website, which is pinnacleprevention.org.
Chatting here with Melanie Mitros, Director of Strategic Community Partnerships with Vitalyst Health Foundation, as well as Adrienne Udarbe, Executive Director of Pinnacle Prevention. Shifting back here to Vitalyst and the grant programs, we touched on it a bit, but want to get back into it a little bit more. How do organizations get involved looking for grants to further their initiatives, and what is the process to try and submit something to be on a short list of consideration in the future?
Well, it's actually great timing to have this conversation. So we do our systems change grant cycles every year. Right now is the perfect time to go to vitalysthealth.org. Go to our grants tab up at the very top. You can read about our different types of grants, as well as you can schedule time to talk with me. We schedule it through email. You can have a conversation with me or have a conversation with other staff to dig into your project and your ideas and find out if they're a fit. Just remember, we're looking for partnerships. We're looking for ways that groups of organizations are changing the way systems work to improve the health of our communities. And it has to be directly including and involving the communities and being driven by the community, just exactly how Adrienne has been describing it today.
Vitalysthealth.org, correct?
That is correct, vitalysthealth.org.
But for both of you here, how do these sorts of initiatives and grants really help to strengthen the community and the importance of having these programs to help people with access to things for better health and what you've all been talking about today?
So I'll talk about it a little bit from the standpoint of a foundation and grant making. Is we've not often seen grants that are available to work on this type of systems change. We are starting to see this changing some. Usually grants are funding great programs that we know work, that are day-to-day, whether it's helping get backpacks to kids or food out there, which is very, very important. And what Vitalyst is trying to do is how can we work together with what is already existing in our communities to then help change the way systems work in our communities. And another exciting part from our standpoint is we actually work directly with other foundations throughout the state on this process. So this last year, Arizona Community Foundation partnered with us and helped fund one of our grants. So it's a great way for organizations that may or may not have an existing relationship with other foundations to also get connected into that conversation.
Melanie Mitros, Director of Strategic Community Partnerships with Vitalyst Health Foundation, and Adrienne Udarbe, Executive Director of Pinnacle Prevention here on Valley Focus, to the two websites that are super important today, pinnacleprevention.org as well as vitalysthealth.org. And then in addition to that, for both of you here, before we wrap things up, is there anything that you want to make sure that people understand about your missions and your goals and what your organizations represent and are all about?
I would just add to this work that at Pinnacle Prevention, we really appreciate the grant-making approach that Vitalyst Health Foundation offers because they are willing to tackle some of the more challenging issues that most funders don't always want to tackle because they are so complex. But what this funding allows us to do, and which is at the core of all of our work, is get to the root cause of the issues that have caused the challenges to begin with. And so you really won't ever fix the problem unless you're getting to the root cause of that. And most of that is rooted in systems and policy. And so the ability to be able to make change and make impact by empowering community themselves to find their voice and have a say in the process is so valuable and important.
One more time for both of you on great websites for people to get involved.
PinnaclePrevention.org.
And VitalystHealth.org.
I greatly appreciate both of your guys' time today here on Valley Focus, and best of luck with Pinnacle Prevention and, of course, people who want to get involved in the grant process at vitalysthealth.org. Thank you so much for your time.
Thank you.
Once again, that's Melanie Mitros, Director of Strategic Community Partnerships with Vitalyst Health Foundation, and Adrienne Udarbe, Executive Director of Pinnacle Prevention, as you have been listening